Sarah Leland.
Hello, Doug.
Welcome to the program.
Thank you.
Sarah is 15 weeks pregnant. She's here to get in a little bit better shape to help herself through her pregnancy and actually help your baby to be a healthier baby. And there's a lot of wonderful things that we'll talk about that exercise does for the fetus and for the mother. Okay? Because if everything's not cool with you, everything's not cool with that baby.
Right.
So one of the things that you're going to go through as you're pregnant is as you get bigger and bigger, a lot more weight's going to be pulling you forward, which is going to possibly cause some low back problems. And low back pain is very common with women during pregnancy. So I'm going to show you an exercise that you can do and that you folks out at home can do to help strengthen your back. Okay. And she's got about a 6 or 7 pound medicine ball here. You can use a dumbbell, you can use a free weight, any kind of weight. A gallon of milk, that's about 8 pounds. Use that. Why don't you go ahead and do it? We're going to do it. She's doing a bent over, and then she's going to lift up overhead and back up. So as she bends over, she's bending over with her back straight, okay? Bending at the hips only, not rounding her back. And with this medicine ball being lifted up over her head, it really challenges all of her back extensors, all the muscles that run up and down her spine. So this is a great way to strengthen those low back muscles. She's also probably getting a little bit of stretch on the hamstrings. There's a hamstring exercise called a straight leg deadlift that you perform, and it's very similar to the motion that we're getting out of the hip right here. As we go into hip flexion with a straight knee, it's going to put a stretch on the hamstrings. And on this, you're always breathing, right?
Always.
Okay, always breathing. Never hold your breath. There's a lot of blood pressure changes that can happen with pregnancy, and a lot of blood pressure changes that can happen with holding your breath during exercise. So we always are breathing as we exercise. And Sarah's doing general fitness, general muscle toning, so she does about 15 reps. And is that what you did there?
15.
Excellent, excellent. Okay, so since you were pretty sedentary prior to becoming pregnant, you signed up with us, found out you're pregnant the next day, and then we started weight training with you.
Yep.
And how about you made some dietary changes at home, it sounds like. Yep. Cardio? Any cardio in there? Walking programs?
Yeah,
anything?
we walk on treadmills at the Y.
That's perfect. That's perfect. And in that time, she's lost over 20 pounds of fat, a lot of body changes. Okay.
Yeah, a lot.
Fantastic. And you're saying it hasn't really been that hard. Okay. Do you anticipate it being easy from now on, or do you think you're going to be challenged with the fast food here? Or?
Well, I mean, that's always a challenge, but it's not too hard because I'm not just, I don't know, maybe it's because I'm not just doing it for me.
Right. You have a little bit of more motivation to take care of that baby. Because that's a question that I often ask people that are trying to lose weight, is that they lose weight and they feel great and they're like, wow, I've never had so much energy, I look so much better, and then 6 months later they put the weight back on, and I'm just like, what does that fast food do for you that exercise and feeling good and being thin doesn't give you? So I'm hoping, I hope that it sparks you to live a healthier and happier life. That's great. And it sounds like you have a lot of family support too, so fantastic.
They're always there for me. So.
That's fantastic. Let's do a second set, and we're going to talk a little bit about this, what's going on with the fetus during exercise. A lot of research has been done with exercise to make sure that it's okay on the fetus, and one thing that they do is determine the stress level put upon the fetus during exercise. And there's a lot of different ways that scientists have tracked that, and one of them is by the staining of the amniotic fluid. What happens when a baby is distressed, a baby inside your stomach is distressed, a fetus, is that it'll have a bowel movement and it stains the amniotic fluid. So that's one of the things that they watch during exercise to see if there's an increased staining of the amniotic fluid, and research has shown that there is no increased staining with the amniotic fluid despite the stress of exercise that is put on the mother and on the fetus. Also, another thing they look at is the activity levels of the fetus. The fetus is always moving, okay? So they monitor the activity levels of the fetus at rest and during the stress of exercise, and they notice that there's no abnormal increased activity or decreased activity, which shows that it's not hurting the fetus for the mother to be exercising. A lot of things, heart rate's another thing they look at. A normal heart rate for a fetus is 120 to about 160, 170 beats per minute. There's no abnormal changes in heartbeat. They're able to tolerate, the baby's actually able to tolerate lower oxygen levels. And this is they think this is due to an increased cardiac function and increased blood flow and volume. And this is great because during delivery there's sometimes a low oxygen level situation for the fetus, and if it's more able to tolerate that, it just makes for a healthier baby. So a lot of neat things going on. Are you excited?
Yes, I am.
Are you?
I'm very excited.
And you're not going to find out the sex of your baby, you said?
No,
you're going to make it a surprise?
Yeah, we're going to wait.
That's fantastic. That's fantastic. Now, she's just now entering her second trimester.
Yep.
And one of the things that we had to change with you is that we can't lie her on her back, okay? Because when you lie on your back and you're pregnant, it can affect the blood flow to the heart. And so we'll put her on an incline bench or keep her standing up like this, but not a lot of lying on your back and not a lot of motionless standing, which of course when you're exercising you don't do, but if you're ever in line at somewhere, you don't want to stand motionless for a long time because that can be kind of hard on the mother's heart. But this is a great exercise for that low back, okay, to help keep your posture good, your low back strong, so you can have decreased pain. Sarah, I appreciate you being on the show.
I was happy to do it.
Are you?
Yeah.
Will you come back?
Sure.
Will you? Okay.
Yeah. The bigger I get.
Okay. I'll be standing over here next time. All right. Well, thanks again.
Thank you, Doug.
You're very welcome.